Good morning and thank you for joining us for a live talk with STEM Ambassador Tehmina. Tehmina is a Pathology Network Education Trainer based at Great Western Hospital down in Swindon. It's great to see so many of you joining us today. So, to celebrate National Careers Week, Tehmina will explain about her career path, including the many diverse roles she has undertaken to date. You will also hear about her involvement in supporting work placements, student visits and volunteers in the laboratory. As you may be aware, we are using a poll today. There's details in the chat. We're using menti.com, but don't worry, if you're not ready for that, then we will still continue anyway. So please feel free to ask Tehmina any questions by putting them into the chat at the end of the talk, and she'll aim to answer as many as she can. So let's get started. Good morning, Tehmina.
Good morning, everyone. I'm obviously not going to get any response back, so good morning, and I hope thank you for all joining me this morning. So I am Tehmina and I'm Pathology Network Education Trainer here at Great Western Hospital. I won't go into exactly how I got to what I'm doing at the moment. I'm hoping that by the end of the presentation, once you've got a better understanding of what pathology is, I'll go through my own personal career path. I'm hoping to make this as interactive as possible. Via Menti. So there's a QR code at the bottom. So if we can join, that'd be amazing. We just need to scan the QR code and type in the code that's at the bottom of the screen. And hopefully that will just get us all answering some questions. If you've got any other specific questions, if you just want to put them in the chat and I can access that page at the end of the presentation, if that's okay. Okay, so just to start and to get us engaged with Menti. My first question is, what year group are you currently in? So that just gives me an idea as who's tapping in this morning. Okay, it's quite varied across the year groups, which is quite nice to see actually. We'll allow a couple of minutes for each one. We've only got 20 minutes for the whole presentation, so. So yeah, that's really good to see actually, because it's quite a nice spread across the year groups. All of access the Menti. Numbers are going up. Okay, right, yeah, I'll move on to the next question. Thank you for doing that. That was more for my information, just to get used to the interactive site, really. So I have the next question. So cross that at the top, don't like saying that. So you're obviously all joined, so I'm hoping that you do have an interest in healthcare science, but just to get it in numbers here. So if you just wanted to put in, if you are interested in a career in healthcare science in the future, or you're thinking about it. That's good. So I'm hoping by the end I can convince everybody to go from the no and maybe to a yes. That's good. It's a nice starting point. I should have really had the same question at the end, because then I could have seen how that changed. But yeah, maybe you can add that in the chat if you can just tell me if you think that now having had the exposure to what pathology is, whether it would change your opinion on whether or not you would consider a career. So we'll move on. So thank you for that. Okay, so just a brief overview of what I'm going to cover today. I'm going to cover what pathology is, what is a biomedical scientist, which is what my role is, the different disciplines within biomedical science, the routes to becoming a biomedical scientist, and in particular, I'm going to highlight two, and that is the apprenticeship route and the T-level route. There are obviously other routes like the A-levels, but I'm going to highlight those two because they are quite new, and then my career path in pathology. So another question here. So it's just to see what is pathology. So just so I can get everybody to see what you already know about pathology. So you can just type in anything that comes to mind, any word. Because all I can see at the moment is numbers. Oh, there we are. Yep, that's good. Oh, well done, that's really good. Okay, yep, that's really good. I'm quite impressed actually. You've got quite a few things there. I'm sure there's more being added, but they're not showing up on the screen. So we've got quite a few responses. Maybe, Lisa, if you could read some out, can you see any more than I can see? Because I can only see, I can see 51 responses, but they're not all showing up on my screen. Oh.
Okay, I can read some out because I can just scroll through here and have a look.
Yep.
So, studying causes of illnesses, study of disease, the study of cells and their functions, study of pathogens, investigation. Somebody thinks it's brain disease study of, the examination of dead bodies,
Yep.
study of bacteria. So they're all quite, a lot of them are quite simple.
Really good.
Somebody thinks it's cancer, bacteria.
Yep.
Studying cells, testing such as blood tests, pregnancy tests, etc.
It's really good, actually. I'm glad to hear that it's quite diverse, the answers. And yeah, I mean, that is basically what pathology is. It covers a lot of that. So that's really good. So we'll move on. Thank you. So this is the definition that's from the RCPath website. So what is pathology? Pathology is the study of disease. It's a bridge between science and medicine. It underpins every aspect of patient care, from diagnostic testing and treatment advice to cutting edge genetic technologies and preventing disease. So that is the official definition of pathology. So that was really good. Okay, so I've just done a little diagram here just to kind of put it all in context. So we are lab-based and based in NHS hospitals, but you also get the private hospitals doing a similar thing. So pathology as a whole is broken down into different disciplines. And when a patient comes into the hospital, we will take a sample from that patient, and you can see my little diagram there, just giving you some examples of different sample types that we can take from patients from different parts of the body. You may or may not have heard of some of these already, so I'm sure you've all heard of urine samples. They're probably the easiest to obtain from patient. Blood is probably the other common one that everybody's heard of. And then you've got more specific things, which is CSF. So that's a cerebrospinal fluid. So you just tap into the spine at the bottom and you extract some fluid. So you can imagine that's quite a painful procedure. And you do only receive a couple of mils of very clear fluid. So it's quite a precious sample. And then we have an FNA, so that's an example of cells that are extracted from any palpable lump in the body. So here I've given an example of the thyroid. So we use a syringe which is attached to a needle. We put that into the palpable lump and extract any cells from that to diagnose if there's any changes in the cells or cancer. So the FNA can be used in any palpable lump, whether it's the thyroid or the breast. I've just given the example there of the thyroid. Then you can also do swabs, which you're probably all familiar with through COVID, so nasal and throat swab. So it's literally just a little medium in the tube, and you just swab in the back of your throat, in the nose, and you put the sample in there, and that usually gets sent over again to the lab. Then here we've got an infusion. That's basically any kind of fluid collection within your peritoneal cavity, which is like down here. And that also can get sent to the lab. And last one on here is a skin punch biopsy. So if you have a mole, or if you have any kind of any kind of discoloration or anything that doesn't look quite right, we can just take a little biopsy of the skin and can send that to the lab as well. So overall, they'll all come to the pathology laboratories, and they are broken down into 4 disciplines that I've put here. There are others as well, but the main ones that I'm talking about is microbiology. So all the kind of nasal swabs that will go, the urine samples, they'll go to micro. Then you have cellular pathology, so that is the study of cells and tissues. So like the skin punch biopsies, for example, that would go over to cellular pathology. We've got biochemistry, and haematology and blood transfusion. So haematology and blood transfusion and biochemistry usually just come under one big bracket of blood sciences. They will take they will obviously do the bloods, they will do the urine samples, CSFs, and that's quite an automated section of the laboratory. So hopefully that just gives you a little overview of the kind of samples we take and the different disciplines within pathology. Like I said, there are other disciplines. That isn't the only thing within pathology, but they're the main ones in the laboratories, the kind of samples. So there's 17 other different specialities under the umbrella of pathology. And here are some of them, and I know some of you mentioned some of these things, so that's really good. So we've got microbiology, which we've seen already, immunology, which wasn't on the list. Cytopathology is again it's cellular pathology, but it's just the cell side. So cytopathology is just for cells. Histopathology, I think, is also on here somewhere. Yep, up the top. That's for the study of tissue. So then we've got transfusion medicine, forensic, molecular, veterinary pathology, virology. Virology normally sits under microbiology, toxicology, genetics, and pediatric and perinatal pathology. So you can see there's quite a lot of different specialities under pathology. Okay, just get a little bit at the top. Right, okay, so just wanted to engage with you all again and see if we can think of some careers in the NHS. I didn't start my timer, so I don't know where I'm at in terms of my timing, but it'd be nice to just let me know when I've only got like 5 minutes left, because I know whether I need to speed up a bit. Surgeon, ambulance, police, nurse, pharmacist, dietitian. Yep, that's all the careers in the NHS. Dietitian, surgeon, therapist, ambulance staff. Yep, there's loads of roles within the NHS. Admin. Yep. Anaesthetist. I can never say that. Toxicologist. Those are really good answers, actually. Yep, you've got the pharmacy as well. Phlebotomy. Well done. Yep, we've got dentists even within the NHS. And you have to remember, it doesn't always mean that they're based at hospital. They can be based anywhere, but still be working for the NHS. Care worker. Yep, well done. That's a good one. Princess. I like that. GP. Yep. That's really good. I like to see the variety in responses here. I think the majority. So you can see as you put the names in, the more responses that we get, the bigger that word gets. So it seems like the most popular ones we've got here are doctor, surgeon, nurse. But like I said, it doesn't necessarily mean that they have to be based within a hospital. They can be working, outside of hospital in private clinics, or like you said, dental surgeries. So that's really, really good. And I'm sure if we just left this, we could just be putting lots and lots on here. So that's really good to see that everybody's engaging in that. So thank you for that. We will move on. Okay, now more specifically, what is a biomedical scientist? So let's see if anybody's got any idea on what a biomedical scientist does. That's another role within the NHS. So. Might be a bit of a harder one. But scientists in the study of biological medicine. Yep, that's a good one. Scientist, medical biology, someone who sciences biology medically. Medicine maker, how the body can heal people. Development of medicine, study of cells. Yep, we've got some really good responses here. I like that one. Scientist that does biomedical stuff. Well, kind of, yeah. Okay, people might still be entering, but I'm going to carry on, so thank you for that. Okay, so biomedical science. So I've spoken about some of the disciplines. It's just a little summary of some of the areas within biomedical science. So a biomedical scientist studies biomedical science. So hopefully that makes sense. So we've got clinical biochemistry. So I spoke about biochemistry as a discipline, and within biochemistry, you'll have clinical biochemistry. It involves the analysis of blood and other biological fluids to assist in the diagnosis, treatment and monitoring of diseases like diabetes. So that would come under your biochemistry. Infection sciences normally come under the bracket of microbiology. So infection science focuses on areas of clinical microbiology, immunology, parasitology and virology, and it involves the study of the culture and identification of bacteria, viruses, fungi and parasites that cause infection and disease, including infectious diseases. So that's normally covered under infection sciences. Then we've got cellular pathology, which is my discipline. It's a study of diseases in organs, tissues and cells to support the initial detection and diagnosis of cancer and other diseases. And finally, we've got hematology and transfusion, which is the study of blood, including the formation of composition, function and diseases of blood. Transfusion science involves the analysis of patients' blood groups, providing safe and appropriate blood and blood components. So if anybody needs a blood transfusion, then yeah, that department will ensure that the blood that they're going to supply to the patient is safe for them. Okay, let's move on. Move on, don't like. Yeah, so this is a quick little video of just a little 3-minute video, just so you can see what it's like to be a biomedical scientist in the laboratory. So I'm just going to play this video. Hopefully you can all see it. Okay, let's move on. Okay, so I hope you enjoyed that. It was just a little insight. Unfortunately, I can't drag you all over here to the labs, although I'd love to do that. That just gave you a little insight into a particular department within pathology. So I don't know if any of you would guess that was blood sciences. It's quite an automated area, and obviously she was processing the blood sample. I've just got a few things here that I've wanted to highlight from that video. So it was the use of PPE, which we're all aware of since COVID. So it's your lab coat, gloves, masks, goggles, things that you have to put on when you enter the laboratory. Obviously, if you're processing certain samples, so you don't always have to have your goggles, but obviously if you're preparing chemicals, then we'd have to make sure we have the goggles on. So that was the use of PPE. We have the analyzers. So it was a blood science laboratory. So you have a lot of analyzers in blood sciences. So you had a safety cabinet in the corner, and we used that to prepare some of the samples that generate aerosols, so just to keep us safe. And then we had a pneumatic system, which basically which is used to receive and receive samples from around the hospital. So they're all divided up into urgent samples like bloods that have come from A&E and then samples that have come from other parts of the hospital. So that was the pneumatic tube system that you may have seen in the corner. The fridges, which are controlled and monitored with all the any kind of samples or any quality control material we need to keep in the fridges. We run daily quality control checks every morning just to make sure that any test that we run on any machine is accurate and it is within the range that we are looking for. So we keep all those samples within the controlled and monitored fridges. Then we had sample reception, which is where you receive a sample, you check in the patient sample, you allocate a barcoded unique reference, and then as the patient sample goes through the lab, you always refer to that patient sample with that unique identifier, just to anonymize the patient's name. Everything has to be protected. So entry into the laboratories, you have to have a swipe card to get in and out of the laboratories. Any data that you're entering on the computer, you have to be password protected. So we're all very conscious about not leaving any patient reports around or leaving any patient data just around, just in case we get anybody from any visitors or anything coming from outside. We have to be very protective of patient data. So confidentiality is quite a big thing within the laboratories. You might have seen on the actual analyzers, you had different processes. So centrifugation, immunoassays, they're all carried out within the machines these days, so that's a lot easier. And then again, on the computer screen, once the results are generated from the machines, we can populate them into a report and automatically send them out to the requesting doctor. So hopefully you could have seen all those things in that video. So there's quite a lot going on in there. But anything you can take from that would be amazing. So we'll move on. Becoming a biomedical scientist. So that is my role, qualified as a biomedical scientist. There's two main routes. You can either go via university, which is the more traditional route, or you can do it by an apprenticeship route. So a lot of people have started to do apprenticeships these days. It just involves a lot more hands-on work and a bit more engaging, and obviously everybody learns in a different way. So it's just another option if people are considering a career in biomedical scientist. How would you pursue that? So you can see from there there's the pros and cons of both. I'll let you have a quick read of them, but I think the most attractive thing would be, although the apprenticeship route is a bit longer, you get on-the-job training, which is what a lot of people want. So you're earning a salary alongside working. So I've got a next page about apprenticeships here. So this is the main apprenticeship and academic routes to becoming a biomedical scientist. So you begin with your GCSEs, 2-year GCSEs. From GCSEs, you can then follow up with an apprenticeship. So you have level 2, 3, 4. Currently, level 2 and 4 are funded by the government. We get a grant for that. So anybody wanting to do that will get a grant, and the fees for the course are covered. So that's quite an attractive thing. T levels, which are a new qualification that haven't come out quite long ago. I'll touch upon that shortly. And then we've got the traditional A-level BTEC route. So once you've studied 2 to 4 years depending on which qualification you've taken, you can then go on to do a traditional degree, become registered and become a scientist. Or you can do a level 6 apprenticeship, which is after you'd have to do your level 2 and 4 to progress onto a 6. You can do that through your employer, but that is equivalent to the degree standard. And again, that would be paid for. So that's quite an attractive option. You have other routes, so then you've got your traditional degree after your A-levels, you get a placement, and again, so the whole point at the end is that you do your qualifications, you become registered by the HCPC, who you may or may not know about, and then you qualify as a biomedical scientist. So just quickly about an apprenticeship. So apprenticeship is job and training. So the job is paid by your salary and the training is paid by a government levy. It's a more practical approach to learning with hands-on experience in applying your skills immediately. So if you're a person that likes to see and do as you learn, that's probably a better option. For you to be eligible, you would need at least, I haven't even put the number in there, 5 GCSEs, English and Maths for level 3 or 4. And it's an alternative to university because you can progress from a level 2 and a 4 onto a level 6, which is at your degree level. So this is just a quick breakdown of the different levels of apprenticeships, level 2, 4, 6 and 7. The 2 and 4 are supported with the grant, the 6, level 2, 4 and 6 are all supported with the grant, and you just progress from one stage to another. It's not likely that you can jump because obviously it's quite necessary. It's like doing your GCSEs, your A-levels and your degree. So that's kind of your equivalent. And then obviously the level 7 is a bit more specialised. So I'm going to just talk quickly about T-levels. So these are new qualifications which you may or may not have heard about. So I'll give you a very short video. So I'll just give you a quick play on this video and we can talk about that.
The health science and the health T-levels in particular are really, really important. T-levels give young people really valuable knowledge and experience as to what the job is like.
I definitely have built confidence in my T-level, knowing that I was able to kind of have some sort of experience in this current course that I'm doing. It is actually going to help me for the future.
It's incredibly important that parents understand exactly what T-levels are, because for many children actually a T-level will be a better option. So this is another route for people to train and come and work for the NHS, which is what we need.
Okay. Right, so I don't know how many of you may or may not have heard of T-levels. Probably would have been worth me just putting another little poll up just to see how many of you heard of what a T-level is, but yeah, they are quite new. There's currently 20 available, but they are looking to roll out quite a few over the coming years, and the main ones for our particular industry in the NHS would be a T-level in health. So you have T-level in science and healthcare science. So each T-level would be specific to particular roles within the NHS. So I have put a link at the end and you can obviously go on and have a look at the different options that are available at the moment. They're equivalent to 3 A-levels, so you would equate the same number of UCAS points if you wanted to do a T-level and then go on to university. And they're practical and knowledge-based learning at school or college with an on-the-job element to it. They are different from the apprenticeships in the sense that they're a lot more classroom based. So you'll have 80% which is based in the classroom and 20% in the industry, whereas with an apprenticeship it's 20% off the job. So it's mainly working with 20% off the job. So the balance is kind of, you know, the other way around. So depending on whether you prefer a heavier setting in the classroom with an exposure to industry, or whether you wanted to just be completely industry based with the element of education alongside it. It depends on the individual. And then after doing your T-levels, because it is equivalent to your A-levels, you can then jump onto a level 6 apprenticeship, which would be equivalent to your degree. So it's just another route really to consider, that there are other routes out there. If you are considering a career in healthcare, it doesn't necessarily have to be through the traditional route that we've all known. It's a 2-year course, which is done after your GCSEs, equivalent to your 3 A-levels, and it's a 45-day placement, which is equivalent to about 300, just over 300 hours. So now hopefully you all know a little bit more about what pathology is. I'll give you a quick brief overview of my pathway. So in the NHS you get banded, it's usually from band 2, and it goes, I've only put up to 8 here, but it does go beyond band 8. So doctors usually come in at, you know, higher level 6, 7, 8 onwards. So I started off with doing the traditional route because at that time I wasn't aware of T-levels or apprenticeship programs. So I did 3 A-levels, that was maths, biology and English. Then I went on to doing my degree as in biomedical science. From that I went on to being employed as a trainee biomedical scientist in cytology. Cytology comes under the bracket of cellular pathology, so it's the study of cells. Once I'd done my training, I became a HCP registered by the Health and Care Professions Council. I achieved my diploma in cervical screening, so that was basically screening women that had any abnormality in their cervix to detect for cervical cancer. So that was you have to screen about 5,000 slides, have them double checked before you can receive a diploma to say that you are competent in signing off reports. I then went on to specialise with a specialist portfolio in cytopathology, so that was a little bit broader, a little bit more in depth and specific to the discipline. I then moved on to my master's in biomedical science, became a senior in cytology and led in andrology. So I don't know if any of you have heard about andrology. So it's just basically fertility testing in males, looking at semen samples, analysing semen samples, and checking people's fertility, and trying to find, you know, treatment plans to be able for the couple to have a child. So I led in that area. I could do a whole lecture on this, but obviously it's a very short presentation, so I'll just move on. And then I specialise in histopathology. So histopathology is the study of tissues. So cellular pathology, which I mentioned at the beginning, covers cytopathology and histopathology. Sorry, there's a lot of pathologies. Pathology just means the study of, so study of cells, study of tissue. So then I moved into histopathology. And in my current role, I'm a Pathology Network Education Trainer. So basically now I oversee the whole of pathology. I'm helping to train individuals that are going through this whole university process or through schools and colleges, and giving them an opportunity to physically come into the laboratories, have a look around, do some student work placements. I get involved with the universities so that they are also on board with what we do here, so that the students from the universities can engage within the hospitals, so they get it's basically called a university placement. So they usually do that as a sandwich year. They come to the hospital, they get that work experience, we can train them, they can do their portfolios, which would get them HCP registration, and then it basically increases their chances of employability at the end. So that's my current role. It's just working with students and working with trainees to try and get them their registration and help their career progression. So that's where I'm at the moment. So yeah, which is why another reason why I decided to take this on board, so I can share this information with all of you guys at the schools, and hopefully inspire you all to consider a career in healthcare. So if you have any questions, if you can put it into the chat, I will close this screen, and I should be able to then access any questions that you might have.
Thank you very much, Tehmina. That was a really fantastic presentation, and I'm sure that we need more than the time allocated to you to find out exactly what happens and what you do in your role. But all sounds very interesting. We do have some questions in the chat, so I'm going to hand you over to Sophie, and she will put those questions to you, because we are mindful that classes need to move on to the next lesson. So yeah, let's go for it, Sophie.
Thank you, Lisa. Morning, Tehmina. So our first question we have got that's come through is, what do you like most about working in pathology?
The variety of the role, really. There's so many things going on, and as I explained, there's so many different disciplines. So there's something for everybody. You know, if you're more of a hands-on person, you've got disciplines where you're doing a lot more bench work. If you're somebody that likes numbers, you've got a lot of the automated kind of disciplines like blood sciences, chemistry, that generate a lot of numbers. So you've got a lot of data that you can sit and analyze, and you can so there's elements of everything within pathology. And now in my new role as Pathology Network Education Trainer, I'm training the trainees across all the disciplines, so I get an insight into all the different disciplines. So yeah, it's very broad, it's very varied, and I think it suits it can suit anybody depending on what your interest is.
Okay, I've got a question just come through. Do you have any advice for someone looking for work experience related to pathology?
Yeah, so I'm based in Swindon, so obviously you are all based in I don't know how far and wide I'm being spread here, but if you get in contact with the with your local trusts, there is well, we have an academy, and they are basically set up with student facilitators, work placement facilitators. So any email, if you go onto their internet page and search up work experience, there should be a link or an email that you can send that will put you in touch with with somebody within the hospital, and they can then forward on that inquiry to the relevant department, depending what it was exactly that you wanted. So here in Swindon, we've got a restriction of 3 days now, because we get so many people that are inquiring to come in, usually during the week that they're given from school. You have to be minimum age of 16, and then we do risk assessments just to make sure that obviously that they're going to be safe also with us. They can't be physically involved with touching anything, so it's quite restricted in terms of what they can do, but it's more of an observational kind of exposure role. So that's something that we offer, and I'm sure most trusts would offer that. So it's just a matter of getting in contact with your local NHS trust, sending the email, just basically describing what area, if you know of any particular area within pathology that you're interested in going to, and hopefully they should be able to put you in touch with somebody that can get back to you.
Brilliant. Okay, we've got a question here from Chatham Grammar School. What qualities are needed to be successful in the pathology field?
It's a really good one. I think technical, it's good to have technical ability, because a lot of the work is very technical. You have to be patient. A lot of the tasks initially as you're doing your training can be quite repetitive. So you do have to have a level of patience. You have to be focused. So in my particular discipline, I did a lot of microscopy. So you can sit at a microscope for hours and hours, 6 hours a day. Broken up, obviously, it's quite difficult to just sit in one spot for so long, but yeah, you can be sitting in one place for a long time, so you do have to have a level of attention to detail, manual dexterity when you're using your microscope, and you have to continue to learn. So we have something called CPD, which is continual professional development. So throughout the time that you're working in the NHS, you will be constantly learning. You have to be somebody that wants to carry on learning, that is interested in any new innovations that are coming through. So yeah, I think that's really important as well. So somebody that wants to learn, somebody that's hands-on, somebody that can be focused, and have a passion for what they're doing. Really
fantastic. Yeah. Okay, so our next question we've got through is, did you always want to work in science?
I enjoyed science. I did biology. I was a little bit skeptical about taking chemistry, just because I was worried. I had friends that had taken it previously and told me how hard it was, so I just kind of avoided chemistry, did maths and did English. Yeah, I definitely knew I wanted to do something science related. Biomedical science, I looked into that and I thought, oh, this sounds very interesting. So it was more of an interest at that point. I didn't know too much about it, to be fair. So it was it's definitely worth getting some work experience, because then you would be able to know whether that is the kind of career path you want to take. And it isn't all lab based. My role has been lab based for the last 15 years, but I've moved out of the lab now to do more training. But there are loads of roles within the NHS, and yeah, you would, even if you start as a biomedical scientist, you can work your way up. You can go into quality, you can go into health and safety. There's training, there's loads of things, that leaderships roles. So yeah, I'm really glad I came into it, but I didn't know at the beginning. I didn't know the options that were out there, and it took my interest. I thought, why not give it a go?
Absolutely, brilliant. Okay, I've got a question. Do I need to choose what area to go in before doing my degree?
So the biomedical degrees cover all these disciplines that I've mentioned. So they work with us, and they work with somebody called the IBMS. You might want to note that down. So the main bodies that you would need to kind of look into are the IBMS, which is the Institute of Biomedical Scientists. They regulate us, HCPC, who regulate us, but Institute of Biomedical Scientists, we are part of the institute. So they're probably two of the things you want to note down to read up about a little bit. But no, your biomedical degrees will cover all the different disciplines that we've spoken about, and then you can choose your modules depending on what interests you as you go through the degree programme. I think one thing to note here, which is really important to mention, is to just check when you are selecting, if it is a degree that you're looking into, to make sure this degree is accredited by the IBMS, because there are a lot of degrees out there that are not biomedical science. There may be biomedical sciences, biological sciences, like a variation of, and they're not all accredited by the IBMS. So what that means for us is when we do have people that start working with us, they would have to do top-up modules. So in effect, they have to go back to university, whether it's online or physical, but you have to top up your module to become accredited and the purpose of accreditation is for you to become registered by the HCPC. So you have to be registered in order to progress up through the bands. So that's a really important point to make. So if anybody is seriously considering a career within biomedical science, just make sure that it is accredited by the IBMS. So that's a big take-home message if somebody is genuinely interested.
Okay, brilliant. Thanks, Tehmina. Just to let everyone know, I have put in the chat the web page from the Institute of Biomedical Science, which puts all the undergraduate UK courses that are accredited on there. So I have just put that in the chat in case anyone wants to have a little look at that. Okay, and thank you ever so much for everyone who's taken part today and put questions in and done the polls. It's brilliant, and we've had loads of enthusiasm. That's great, and thank you so much for your absolutely brilliant talk, Tehmina. I'm just going to pass over to my colleague Lisa, and she's just going to finish off. Thank you.
Thank you, Sophie, and Tehmina, thanks again. And I've just actually realised that we have this talk today to support National Careers Week, but you've covered both because it's the start of British Science Week today.
Yeah,
so
that's good.
Two with one talk, so thank you very much. And I'm sure the audience has been inspired to learn about the many careers within healthcare and perhaps now more interested in a career in pathology. So thank you. As I mentioned, we've had live talks taking place to support Careers Week, so you can have a look at our website at thestemhub.org.uk for more brilliant careers advice like Tehmina's given you today. And there's lots of pre-recorded content on there created by STEM ambassadors like Tehmina from various industries. So thank you for being with us today. We hope you enjoyed it, and we hope to see you in the future. Goodbye.
Thank you.